Everolimus, also known as Afinitor, is a medication used to treat different types of cancer, including kidney, breast, pancreas, lung, stomach, and intestinal cancers. It can also be used to treat certain types of benign tumors in the brain or kidney in people with a genetic disorder called tuberous sclerosis complex. Afinitor works by slowing down or stopping the growth of cancer or tumor cells. The daily dosage and optimal timing for taking Afinitor will depend on the individual's specific condition and should be determined by a healthcare professional. Before you start taking Afinitor, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once daily. You can take it with or without food, but it's important to choose one way and stick to it for every dose. Swallow the tablets whole with a glass of water, and do not crush or chew them. The dosage of Afinitor is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. Make sure to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are taking Afinitor to treat a certain type of benign brain tumor, the dosage is also based on body size. Use Afinitor regularly to get the most benefit from it, and try to take it at the same time each day. Do not increase your dose or use this drug more often or for longer than prescribed. Your condition will not improve any faster, and your risk of serious side effects will increase. It's important to avoid eating grapefruit or drinking grapefruit juice while using Afinitor, unless your doctor or pharmacist says it's safe to do so. Grapefruit can increase the chance of side effects with this medicine. Lastly, since Afinitor can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the tablets. Some common side effects of Afinitor may include diarrhea, nausea/vomiting, decreased appetite, weight loss, changes in taste, nosebleeds, dry skin, dizziness, headache, and pain or sores in the mouth and throat. To reduce the risk of getting mouth sores, your doctor may prescribe a special mouthwash and recommend brushing your teeth gently. Temporary hair loss may also occur, but normal hair growth should return after treatment has ended. More serious side effects may also occur, including swelling of the hands/ankles/feet, missed/heavy/painful periods, easy bruising/bleeding, unusual tiredness, mental/mood changes, wound problems, signs of kidney problems, increased blood sugar, increased cholesterol/triglycerides, decreased ability to fight infections, worsened side effects from radiation treatment, lung problems, liver disease, and a rare brain infection called progressive multifocal leukoencephalopathy, PML. If you experience any of these serious side effects, it's important to contact your doctor right away. Additionally, if you notice any other effects not listed here, be sure to inform your doctor or pharmacist. Before taking Afinitor, make sure to inform your doctor about any allergies you have, as this medication may contain inactive ingredients that could cause allergic reactions. Also, let your doctor know about your medical history, especially if you have liver disease, infections, diabetes, or high cholesterol/triglyceride levels. Afinitor may cause dizziness, so avoid alcohol and marijuana while taking this medication. It's important to be cautious when driving or using machinery. This drug may also increase your risk of getting infections or make current infections worse, so stay away from people with contagious illnesses. Be sure to inform your doctor if you have been exposed to an infection or need more information. Before receiving any immunizations or vaccinations, let your healthcare professional know that you are using Afinitor. It's important to avoid contact with individuals who have recently received live vaccines. Take precautions to prevent cuts, bruises, or injuries, and inform your doctor or dentist about all the medications you are using before having any surgery. If you are an older adult, be aware that you may be more sensitive to the side effects of Afinitor. This medication can also affect fertility in both males and females, so be sure to ask your doctor for more details. If you are pregnant or planning to become pregnant, it is important to discuss reliable forms of birth control with your doctor, as Afinitor may harm an unborn baby. Women who are pregnant or may become pregnant should not handle this medication or breathe the dust from the tablets. It is also not recommended to breastfeed while using this drug and for 2 weeks after stopping treatment. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Afinitor. These interactions can change how the medication works or increase the risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Afinitor include other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab, as well as ACE inhibitors like captopril and lisinopril. Additionally, there are other medications that can affect the removal of Everolimus from your body, which may impact how Afinitor works. Examples include azole antifungals, cobicistat, macrolide antibiotics, nifazodone, HIV protease inhibitors, ritonavir, St. John's wort, telithromycin, and others. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If you or someone else has taken too much Afinitor and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or reach out to your local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center for assistance. It is important not to share Afinitor with others. Before starting and while taking this medication, you will need to undergo various lab and medical tests such as blood sugar, cholesterol/triglyceride levels, complete blood count, kidney function, and Everolimus trough levels. It is important to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take a dose of Afinitor, you can take it as soon as you remember, unless it is more than 6 hours after your usual dosing time. In that case, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. Remember to always follow your doctor's instructions on when and how to take Afinitor. When it comes to storing Afinitor, make sure to keep it in its original container at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When it comes to disposing of Afinitor, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.